A person has to quarantine themselves when they have been exposed to the COVID-19. Now, what do we mean by COVID-19 exposure? It means either you've traveled from a high-risk country and you have been actually exposed with COVID-19, so you have a history of travel, or within the country. For instance, now we have people who've tested positive for COVID-19, and if you've got an exposure with a person who's tested positive, then you need to have or be in home quarantine. Now, what does that mean? You need to stay indoors for a minimum of 14 days. What happens during those 14 days? If you're in a home where there's more than one person living with you, you need to make sure you identify a particular place, a particular room, and you stay in that room for 14 days. If you happen to use the same bathroom facilities and toilet facilities, make sure when you do access them after your use, they are actually being disinfected with household disinfectants. Do not use the same appliances at home when it comes to cutlery such as cups and pans and plates as well. Make sure you don't use the same things, and if after use, you don't have to go and disinfect them, no. You can just use warm water and soap, liquid soap, and wash the appliances. That's what we mean by home quarantine. The whole idea is we want to see for the 14-day period, the incubation, whether you're going to get any symptoms. And if you do get symptoms, then you reach out to the numbers of the authorities of the National Public Health Institute and the Ministry of Health. The toll-free number in Zambia is 909. That is home quarantine. Now, a lot of people are getting overwhelmed with all these terms. So what is the difference between home quarantine and staying at home? Everyone has to stay at home. The whole concept behind staying at home is physical distancing. Physical distancing, you don't want to go to high places where there's a lot of people and you end up catching the infection if there is community transmission in that area. So staying at home is practicing physical distancing. Now let's talk about isolation. A person is actually isolated when they test positive for COVID-19. So let's go back to the first definition that I gave you about home quarantine. If you are in home quarantine and you are tested for COVID-19 and it comes back positive, then the health officials will isolate you. So that is the difference between home quarantine, physical distancing, and isolation. Another point that you need to understand about home quarantine is that you cannot leave your home to go buy maybe groceries or go run an errand or do any other activity that you feel you want to do. You are strictly supposed to stay indoors. If you can, get your network, your friends, your family to help you. But otherwise, stay away. Practice quarantine the perfect way by not going in public.
For more information on coronavirus, or if you think you have any symptoms, call the helpline on either of these numbers: 0974 493 553 or 0953 898 941 or 0964 638 726. Or toll free on 909. Remember to practice hygiene care and wash your hands regularly. This way, we all stay safe.